Stefania. I'm going to be your nurse today. I'm going to go ahead and pull the curtain and shut the door. I'm also going to go ahead and use hand sanitizer. Do you mind if I check your wrist brace? Can you go ahead and tell me your full name and date of birth? Perfect. Okay. So it looks like that the doctor has ordered for you to go ahead and get a Picc line dressing change. You have had it in for 7 days. Is that okay if we go ahead and do that now? Okay. So I am going to go ahead and raise the bed to a working level. I'm going to make sure my patient's head of bed is elevated. Do you have any allergies to any tapes or any adhesives or anything like that? No? Okay, perfect. So when we do this procedure, you have two options. You can either turn your head away from the procedure or you can wear a mask. What would you like to do? Turn your head? Okay. So I'm just going to set up a little and then we'll get started. So I'm going to go ahead and put my hand sanitizer on and just put some gloves on for now. So I am going to just put the pillow under your arm so it's a little more comfy. And then this is just a pad, waterproof pad. So I am going to go ahead and visualize the Picc line. I'm going to make sure that there's no redness, no swelling around the site. I'm also just going to palpate it, make sure that there's no bumps or anything. Are you having any pain with it? No? Okay. So I'm going to go ahead and get started. If you don't mind, just go ahead and turning your head that way for me. I'm going to remove the gloves I had on. I'm going to use some hand sanitizer. And I'm also going to wear goggles. So I'm going to go ahead and put clean gloves on. We're going to go ahead and remove the dressing, working from the outside towards the inside. And I'm going to throw that away. So visualizing the dressing, it looks clean. There's no redness under the dressing. I'm going to go ahead and measure what is left on the outside to make sure it's the same measurement from when they put it in. And it is the same measurement. I'm going to go ahead and remove my gloves. I'm going to use more hand sanitizer. So at this time, I'm going to go ahead and open my kit. I already know my kit is not open, that it's not expired. I'm going to go ahead and take out my sterile gloves. And then I'm going to go ahead and take my chlorhexidine. I'm going to work from the inside out. I'm going to trash that. I'm going to get my second wipe of the chlorhexidine. I'm going to clean on the outside for 30 seconds. I'm going to trash that. Once this all air dries, and I know it's dry, I'm going to put the new thing that goes around it. And then I'm going to go ahead and use the skin protectant wipes. I'm going to use it all around it. I'm going to wait for that to dry. At this time, I'm going to use the dressing. For the purpose of this video, I have already used it, so there's tape just to help keep it sticky. I am going to go ahead and put it on. I'm going to make sure that it is centered. Once I have it centered, I'm going to work one side and then I'm going to apply the other side. So now that my dressing is fully on, it's all secured, I am going to take the label that comes on these. I'm going to initial, I'm going to put my date, I'm going to put the time and anything else that the hospital requires, and I'm going to go ahead and stick it on there. I'm also going to go ahead and check the caps per policy of the hospital, and I'm going to go ahead and flush per policy of the hospital. Are you having any pain with this, or are you okay right now? Okay, so I'm going to go ahead and remove the pillow. I'm going to make sure that my patient is still comfortable, that they don't need anything else. I'm going to lower the bed to the level that they need. I'm going to go ahead and clean up all my stuff, throw it all away to the appropriate areas. I'm also going to go ahead and document on my patient. I'm going to document, how much of the measurements of it, that the patient handled it with no problems, that they had no pain, how did it flush, And then I'm just going to make sure my patient is good before I leave.